Many women after breast cancer ask, why do I have arm pain and other arm problems when I did my exercises after surgery? Many cancer care health professionals believe that stretches or arm exercises will successfully help women recover their arm movement after breast cancer surgery. Research does not support use of stretches or exercises alone as a successful recovery strategy for women after breast cancer. My name's Denise Stewart. I'm an occupational therapist. Let's look at breast cancer rehabilitation in Australia. Firstly, let's look at the results across the world. They're clear. Pain and other arm symptoms occur more after mastectomy, axillary node clearance, and radiotherapy, and symptoms can be long-lasting for many women. Next, we'll look at the paper. Current rehabilitation processes do not prevent long-term impairments after treatment for breast cancer in Australia. The authors Elizabeth Dilk and Sharon Kilbreth. The survey was completed by 387 women from the research and survey group from the Breast Cancer Network Australia membership. The women were divided into two groups, the sentinel node biopsy group, SNB, and the axillary lymph node dissection group, ALND. And you can see the ages and the years from 1 to 5 represents the years after their surgery. So most women were in this group. They looked at where they received their treatment, and most women received their treatment as a private patient and hospital. A quarter of the women received care in public hospitals. Of the women with sentinel node surgery, 49% had mastectomy, 51% with lumpectomy, and 57% of those women had radiotherapy. Of the women with axillary node dissection, more had mastectomy, 30% with a lumpectomy, and 69% went on to have radiotherapy. The authors looked at arm-specific exercise advice only and general exercise advice. And this section is looking at arm-specific exercise advice before surgery and after surgery. So more people received advice after surgery, and of those people, most people received both types of advice, so written and oral advice. In fact, women reported a high rate of use of exercise and stretch during their recovery. The authors note of those who received arm-specific exercises, 71% commenced their exercises within 2 weeks of completing surgery. However, 12% did not complete the exercises at all. The main reason being that they thought that they didn't need it because they'd recovered well. Of those women that did do their exercises, 76% felt confident about which exercises to perform, and 62% felt confident about when to progress their exercises. Let's look at the frequency of arm symptoms in the first year. So if you look at the chart, we've got the SNB, sentinel node biopsy, and ALND, axillary lymph node dissection. In pain, swelling, difficulty raising arm, and weakness, women with axillary lymph node dissection had more experience of those symptoms than women with sentinel node biopsy. The first two bars are the number of women with mild symptoms. The second two bars are the number of women with moderate to severe symptoms, and the last section is very severe symptoms. And more women experience moderate to severe symptoms in difficulty raising arm, weakness, cording, and tingling. This chart shows the time of arm symptom recovery reported by women. The black section shows women who recovered after 12 months. The hatched section shows women that had not yet recovered, and that was between 20 and 40% of women. 60% of women with sentinel node biopsy did recover in the first 6 months. The authors found that women who underwent a mastectomy more commonly reported chest or breast swelling but not pain compared to those women who had a wide local excision, or otherwise known as a lumpectomy. They go on to say that from this survey, it is clear that the current processes of rehabilitation after treatment for breast cancer in Australia are insufficient to reduce the physical impairments arising from the treatment of breast cancer. The authors comment about the barriers to women getting help. Firstly, that there are no systems for monitoring arm symptoms and scar tissue responses after surgery or radiotherapy in Australia. Also, that women may not be initiating the reporting of arm symptoms. And then doctors have a low referral rate to pain or rehab specialists. So what are women doing about this? Well, they found in this survey that more than half of the respondents are reported to seek care outside of their treating hospital and frequently paid for these services out of their own pocket. So if stretch exercises may not be working for you, breast cancer rehabilitation professionals offer assessment and treatments other than arm stretches. Research does support the use of low-level laser and specific massage techniques for scar tissue. If you have pain or other arm symptoms during the first year, speak with the breast cancer team. Ask for a referral for a breast cancer rehabilitation therapist, and campaign for physical screening of arm and shoulder and breast symptoms. So that can be pain, breast swelling, breast scar tissue, AWS, cording, tingling and weakness.